Lectures from the Academy. The title of this podcast is No Room at the Inn, and it is one of a group of lectures selected from the many classes taught by Dr. Gregory T. Lawton to the students of the Blue Heron Academy of Healing Arts and Sciences from 1980 to 2022. Dr. Lawton founded the Blue Heron Academy in 1980. Since that year, thousands of students have learned the practice of true traditional healthcare at the Academy and have gone on to establish practices, serving the healthcare needs of their patients. Dr. Lawton is a licensed chiropractor, napropath, and acupuncturist, as well as a certified naturopath. Hi, my name is Chrissy Dawn, and for the next few minutes I'm going to share with you a lecture from the Blue Heron Academy entitled, No Room at the Inn. Let's begin. I began my training in healthcare in the early 1970s. I was fortunate in that I trained with doctors that had either gone to school or practiced in the 1800s. Yes, the 1800s. I sometimes tell my students that as improbable as it seems, I am a bridge between them and 2 centuries of healthcare. What I can tell you is that the old doctors that I trained and practiced with had an entirely different medical ethic than what I see in many doctors today. They made a modest living serving the public good. They were not millionaires. They did not earn hundreds of thousands of dollars a year, or as specialists do, $1 million or more a year in salaries and commissions. And they did not earn bonuses by denying patient care. I am, of course, aware that there are exceptions to the cult of power and greed in medicine, but we wouldn't have a healthcare crisis if there wasn't massive corruption within the prevailing medical profession and its institutions. A few weeks ago, a man named Tom walked into our clinic and asked to see me. Tom did not have an appointment, but he wanted to talk and to get some input regarding some personal health issues. I sat and talked with him for a while. Tom has 2 herniated discs and spinal stenosis in the lower back. He's in a lot of pain. His orthopedic physician is recommending fusion of several vertebrae in the lower back, and his chiropractor disagrees. I agree with his chiropractor. Most lumbar disc herniations, while painful for weeks or months, eventually resolve themselves. Only about 2% require surgery. Surgery is usually determined by adverse neurological symptoms, such as foot drop or loss of bowel or bladder control. Sometimes, due to extreme pain, the patient begs for pain relief and surgery. Tom does not want surgery, and he does not have these neurological risk factors. After spending some time talking with Tom and making some simple recommendations, I referred him to another physician for another opinion regarding the lumbar fusion issue. Tom followed up on my advice, only to be turned away by the doctor because he did not have the right medical insurance. The right to competent, affordable health care is a human right. The old doctors that I trained and worked with taught me of their ethic of never turning a patient away, especially because of money. Simply as a matter of ethics and to serve the public good, I adopted the policy of never turning patients away, of never charging patients with a terminal illness, and of treating children at no charge. I found that there was never any shortage of paying patients upon which to build a successful practice. We live in challenging times, and not everything improves with time, at least not in the short term. Perhaps someday our doctors and the medical community will use their moral compass, regaining their direction and walking a different path. I certainly hope so. When I accept and work with patients in need, pain, and suffering, I remember this quote from the Baha'i writings. The poor in your midst are my trust. Guard ye my trust, and be not intent only on your own ease. This has been your narrator, Chrissy Dawn, and it has been my privilege to share this lecture and podcast with you. I hope you will continue to listen to our lectures from the Academy podcast series. There's room for you at the inn. Until next time, stay healthy.